Has the profile of the typical GLP-1 patient in your practice changed over the past couple of years at all?
I would say no, because I do elective plastic surgery, so I'm not treating diabetes patients who are diabetics, and they're generally healthy patients. So my typical patient is really overweight relative to themselves. And so, just doing the math, that might be someone who weighs 150 pounds, but they used to be closer to 135. And so that 10% of their starting weight is in by almost all measures going to offer health benefits for them. And they're also probably someone who's not obese on the typical BMI scale. But, 15 pounds for a woman in generally is at least a size and a half on their clothes. So I think that these are really, that is something significant. And I think that the science is starting to catch up with, they're not just calling people morbidly obese, but they're calling, pre-obese. But I think that, again, Big Pharma is not motivated to treat someone who, is otherwise having normal health parameters, for liability reasons. So it's left to, regular clinicians who are treating people to deal with this in an off-label manner.
Yeah, and Kelly and Dr. Olive, have your patient profiles changed at all when it comes to people that are coming into your practice?
So we don't have a practice, and we don't have patients. So I think that's the important thing to clarify here. We work with people who want to get the most out of their time on the medication. So they don't come to us as a patient. We don't prescribe the medications, and we don't make dosing recommendations. I do think we probably see a different clientele than a plastic surgeon. A lot of the people that we work with are, they are actually more in the very overweight, obese category, but they are still mostly using the compounded medications. But I don't think, in the 2 years we've been doing this, we have not seen a significant change.
It's really interesting because, in just in general, you hear about GLP-1s a lot more, and there's definitely this feeling that people are incorporating them in different ways, or maybe kind of seeking out expert advice who wouldn't necessarily be the typical people using GLP-1s. So that's really interesting to hear. Um, where are you seeing the biggest difference between clinical trial outcomes and day-to-day practice? Is there a huge difference in what you're reading versus what you're actually seeing?
I would say that what is out there, again, is they're studied on obese patients. And um, and I think that I think's an important fact to understand is what qualifies as an effective chronic weight management medication according to the FDA. So their guidelines are if someone loses 5% of their starting weight in 12 months, that's something that's effective. And so just taking someone who's 200 pounds, that's 10 pounds lost in a year. I can't imagine that I would have any single patient happy on that. And so I think that a big distinction is, um, and really what I measure the success of our program on is that getting someone to their target weight. And that has a lot to do with, what was their low sustainable weight as an adult. And I think that that is a real big distinction. And a lot of weight loss programs don't make a measure of success. I mean, even if you look at Weight Watchers, I mean, it's very, very hard to pull any data out of their long-term success there. And I think that people don't want to do that because the results are bad.